Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Cortical Capacitor series or edition. This audio podcast is part of MaxxaR Pathology. This audio podcast as part of a Storm Robotics production. In this audio podcast, a little bit around libraries and around looking at libraries and health or healthcare partnerships. So the need for for the general medical practitioner to work in close partnership with education professionals was highlighted some years ago. Highlighted some years ago in a sort of an occasional paper, a paper from the Royal College of General Practitioners, who um, uh, from the Royal College of General Practitioners, where this and a sort of a direct excerpt is was thus. So for patients to become fully interactive with sort of treatment or regimens and care, there needs to be there needs to be a sustained education program developed within primary healthcare. The need for patients to be fully interacting with aspects around healthcare has more recently or had been reported in works referred to as the oneless report, and although sort of although a little bit sort of retrospective, the Monolith report had informed that fully interacted patients and carers were likely to save the NHS um, um, millions of pounds, millions of pounds of unnecessary spending. And similarly, the importance of supporting patient education and patient and care learning and patient care learning was also emphasized in the report. Um, the General Medical Council (GMC) in a document referred to as a good medical practice from 2013, insists that doctors or physicians must give information to patients in language and terminology in language and terminologies that can be understood, and this information should relate to conditions and treatments available together with possible adverse effects and medicines and procedures, so that patients following GP or consultant consultations can truly give informed consent to treatments and procedures to treatments and procedures. This is clearly quite impossible in times available during the average during sort of average sort of consultations where consultations are between 7 and 11 minutes, for example. Even more impossible when when language and culture, for example, is not shared by a physician. Just as community access has become an important sort of component of at least in some contexts public library services, so too has the patron around technology sort of awareness and technology sort of services and sort of and training. Although public libraries face many challenges or have faced challenges in efforts to provide access to services, they are embracing sort of the role around bridging the digital divide. they continue to expand services and innovate expand services and sort of prompt sort of inventive sort of services around practices. In spite of the importance of these of services, public libraries still have faced a number of challenges in efforts to provide access to resources. Increased use of tech, sort of training classes coincides with increased use of library resources in sort of globally representing an increase in demand on uh, an increase in demand on library resources and staff. Um, over 65% of libraries have reported they have insufficient public access to meet patients' needs during at least some part of a typical day. Most libraries, wherein around just over 60%, have reported an increase in the usage of public access internet in a particular fiscal year. Increasing demand means many libraries have established time limits for patrons using public access desktops, which has significant impact on people who lack other means of access, who lack other means of access around information. Technology training competes with other library services in its importance to in its importance to community. Um, uh, other services are consistently ranked amongst the most important services to community provided by libraries. So, for example, government-based services, and sort of job seeking or occupational or based services. Um, public library the public library uh, amongst the evidence has is evidence as perhaps one of the only is the sort of only or one of the few sort of community resources addressing these issues. Librarians, for example, often must combine things around instructions around library services, library services and healthcare services where applicable, but also linked with linked with aspects around health literacy also where applicable. That draws this audio podcast to a close. This audio podcast is part of a Cortical Capacitor edition or series. This audio podcast is part of a MaxxaR Pathology. This audio podcast as part of a Storm Robotics production.